These are our pictures from our first mission trip to Ghana. We were very fortunate enough to have the opportunity to be able to go and travel to West Africa to do some health screenings, some health education, visit hospitals, learn about nursing, and even had the opportunity to visit nursing schools, as well as tour different areas, various sightseeing places and locations. So this is our trip. We started off in LAX. We took a flight to Amsterdam and we had a 10-hour layover. So a few of us decided to take advantage and go and see some of the sights. So we took a boat and got lost. We ate at a little restaurant and then we came back. And that was to help prepare us for the last leg of our trip, which was about 9 hours. When we arrived at the airport, we were hit with heat. And now we realize we are in Ghana. It's totally exciting just being there and the work that we were going to do. Fortunately for us, we were able to stay at my parents' home in the city that housed us. And so that was our first night, just kind of acclimating to our environment. We couldn't wait to get started. The first thing we want to do is just kind of explore. So we go to the Accra Mall, which is in the city, and that was a great opportunity for a lot of the students to be able to see the day-to-day experience of the middle-class people in Ghana. The first day we were there, we were fortunate enough to go to Faustina, who was another student whose family's from Ghana, her family's restaurant. So that was the first night, and we ate banku and tilapia, which is one of the traditional dishes. And so that was nice to be able to see the students enjoying the cuisine and being in the environment and just kind of taking in like the experience of we're really in Ghana. So that was our first day actually in the city, just kind of exploring. So that night we spent the evening dividing up a lot of our materials that we brought to give to the clinics and hospitals in the area. Thanks to our Mini Mission Maker grant, we were able to purchase glucometers, blood pressure cuffs, stethoscopes, gloves, much needed supplies that the hospitals had kind of requested. If we could donate, these were the things that they'd ask us for, as well as gently used clothing and new clothing for babies and newborns. They expressed that many of the parents come in oftentimes with no clothes for their children. So this is day one of our actually getting out and getting moving. Thanks to our partnership with Global Health Services and our relationship with Roger Williams, he had connected us to an orphanage in a very remote area along our way to the village where we were going. And on this route, it was very fun. This is our first road trip, and it was interesting because on the way we got stuck in the middle of the bush, and it took 2 hours for them to dig us out of a hole. But when I tell you that we had a wonderful driver who was able to solicit people to come and help us move our bus, it was a very funny, great experience. I mean, looking back on it, we can smile and laugh, but we were a little bit nervous because the sun was going down. Finally, we arrived at the Bosco Orphanage. Many of these children had no parents, or they had parents and families that could no longer continue to support them, so that's why they were there. And we're just amazed. There must have been at least 200 children, and they were so excited and happy to see us. So they gave us a tour of the orphanage, and the kids shared with us their goals in life. Some shared that they wanted to be nurses. Thanks to the support of Northrop Grumman, we were able to bring each of the children airplanes, and to see how delighted they were to fly these airplanes. Some of the kids were so excited that they didn't want to open them because they wanted to save them for later and watch the other kids play with theirs. As a token of our appreciation towards us, thanks to the kindness and generosity of Lorraine Gray with the Saturday Science program, we were able to offer each of the children a Charles Drew Saturday Science t-shirt. And they were so happy. I don't know if it touched them as much as it touched us to be able to see the joy that we were able to bring to them for that short amount of time, but it was so rewarding. Afterwards, they asked us to paint our names on a rock that is in the foundation of the orphanage so that anytime visitors come, they'll be able to see the Charles Drew name etched in the rock as a symbol and token of us being there. So that was a great experience, and I don't think that there was a dry eye amongst us as we left because they were so happy to see us and so sad to see us leave. The next day, we were preparing to get ready for a local health screening in the village where we were staying at. The village we're staying at is called Kukrantumi. This is my family's village. In this village, my mother's sister is the queen mother, and my great uncle is the chief in this village. With their permission, they allowed us to have a health screening at the Royal Palace. So the night before, we were able to meet with the local broadcaster who has a radio program that broadcasts to over 1 million Ghanaians in the local area. So we were able to announce that we would be having a health screening the next day for all of those who were interested in participating from 8 to 12. And the response was overwhelming. That day alone, we saw over 300 patients. We set up our screening area to provide blood pressure, diabetes screening, and then education. It was very eye-opening when you talk about health disparities and some of the challenges that the people of Ghana have when it comes to adequate resources for health. Many of the patients came in with high blood pressure. We saw elevated blood pressures of 180 over 110, 220 over 110, and these people were functioning. Much of the time was spent on educating them about, although you feel better, you still need to continue to monitor your blood pressure because high blood pressure is a silent killer. A lot of time we just spent educating patients on the importance of making sure that they follow up with their healthcare providers. In Ghana, they have universal healthcare system that they all pay into, and so many of these things and comorbidities can be avoided if they just followed up with their practitioners. But because of the poverty level, I mean, a lot of these people, it's a choice between, do I eat tonight and feed my family, or do I pay for this health care? So does that mean that they don't get treated? Well, it depends. In one hospital that we went to, mothers who did not have the money to buy blood did not receive blood. They just made the mothers wait, so they couldn't deliver their babies. They didn't give them any blood because they were more concerned about making sure that they paid. And they felt like if it's last resort, the family will come up with something. And another hospital you go to says, well, if the parents can't pay, we'll figure it out. We'll give the blood anyway, and we'll worry about it later. A lot of it comes down to the leadership of a hospital. You know, this particular hospital also said that, you know, they didn't have malaria netting because they didn't have the right screws to fit in the ceilings. But another hospital that had the same limited resources had netting for every patient bed. A lot of it is just education. Lack of education, lack of new technology, lack of new information, lack of new resources. When I spoke with one of the nurses and I asked them, you know, are you interested in going further? Are you interested in getting your master's? And they said, well, what's the point? We don't get paid anymore. We don't have enough conferences for us to be able to really build our knowledge and understanding of evidence-based practice. We don't have invitations for us to be able to travel outside of the country to learn new things. So everything that we learn is basically from people who come in and share what they have with us, which was also great because we were able to donate some books to help at least give them a little bit of something. There were various posters all over the place talking about some of the local challenges like guinea worm, malaria, snake bites, dengue fever, cholera. At the time we were in Ghana, there was a cholera outbreak in Accra.
Open drains choked with filth remains a permanent feature in most parts of Accra. This is a perfect condition for the spread of cholera germs, as the scourge of the disease continues to threaten the lives of people.
And they say that they have these outbreaks every so often. So they have a lot of posters all over the place. Even the poster about guinea worm was for people to report if they knew somebody who had it because it's easily transmittable. One of the great pleasures that we had was we got a chance to meet a gentleman by the name of Dr. Endum. Now, Dr. Endum has several resorts in the area, but he's very committed to helping the people in his community. So in our conversation with him, he shared with us that he's interested in having a health screening for the people in his village and also his staff at the resort. And he would be very interested in us coming back. So that was really nice. Right now, there's an Ebola crisis that's going on, and 4,000 people have lost their lives. And there are going to be more lives lost because there's not enough education. There's a lack of resources for people to even prevent this. And it's really important for us, citizens of the world, to look out for our brothers and sisters. Unlike in the United States, most of our food is fresh, cooked fresh, and they start early in the morning. So you'll see some pictures of the women pounding fufu, which is a local staple. And a fufu is a combination of pounded yam or pounded plantain that's been boiled, and then they pound it with the pounding sticks. It looks easy, but it's really, really difficult. You have to pound the stick according to the rhythm so that you don't smash the preparer's hand. So, it takes practice, it takes skill. Some of our traditional dishes include a lot of seafood, a lot of live fish that they will catch from the sea, or there are tilapia ponds that, we were able to go to a tilapia pond and get some of the fish that they bred there. The food was the most interesting part. We were also very fortunate to visit the Nursing College of Kofodria, which is a nursing and midwifery school. We were able to get a tour of their facilities and their RN program, which is very similar to ours. And so we saw some of their care plans, we saw some of their books that they read in the library, and we met some of the nursing students who shared their struggles similar to ours when it came to studying and passing exams. We had the opportunity to go to Bonsu Arboretum. So the Bonsu Arboretum has been around for like the last 7 years. It is a local forest, and so you kind of get a guide who will take you around and show you all of the horticulture in the area. There are trees that have been there for almost 130 years that they used to tap, and it makes a loud noise that can be heard through the forest to let you know that there are people coming into the town, whether or not it was to invade or for a war. It would sound the alarm. And then we did the canopy walk. And the canopy walk is 20 stories up. It was a really nice experience, but it was raining. It was sprinkling that day. So we were walking on this canopies, and it was sprinkling. So it was like wet everywhere, and it was so scary, but we all made it through in one piece. And nobody got lost. And so afterwards, we went to the waterfalls, which was a 30-minute drive. So when we get there, they're like, "Oh, you guys are going to go, aren't you?" And we're like, "It's raining." And they're like, "So?" We drove all this way. You guys need to go. So we're like, "Okay, how long is a walk up?" And they're like, "It's not far." So we're like, "Okay, we can do it." So Dr. Manley's like, "Let's go. I'm ready." So we start walking up, and every time we turn around and ask them, how far is it? They say, it's not far. We'd keep walking. How far is it? It's not far. It's just right here. In total, it was like an hour walk in the rain. I think everybody must have slid and slipped in the mud at least once. The beauty of that waterfall, I don't think anybody could put into words how well worth it was for us to be able to take that hike up those hills.
You can also snap a picture.
I can still picture.
You can snap one too, yeah.
I should do it.
Yeah, just snap.
And it was so funny because by the time we got up there and saw it, and we're just in awe and marveling at, like, we need to go because it was so late and dark. We didn't want to get stuck. That night, half of us didn't even speak to one another because it was just like attitudes. It was funny though. We traveled to the Cape Coast slave castle. In Ghana, there are, I believe, 42 slave castles and forts. But operational and running, there are about 9. And the Cape Coast slave castle is one of the larger slave castles on the hub of West Africa. And why they call them castles is because they're these big fortresses that used to house slaves. We were fortunate enough to be able to take this tour. And I always tell people, there's a feeling that you get inside there that is undescribable. It's something that you can never understand. 100 slaves being housed in this small room, but you're actually standing on years of urine, feces, blood of these people, and you feel their souls, you feel the pain that they went through. And when you walk and you hear the stories and you learn about their experiences, the door of no return, where the slaves actually were taken out onto the ships. And it was a one-way door. You just went out. Nobody ever came back in. And you're able to go out and see the ocean where they began their journey. And, you know, they shared stories about how some people just killed their children because they didn't want them to experience that. And oftentimes they didn't even know what they were getting themselves into. And it's just sad. You feel the anguish that they went through. I don't think you can come back the same person after experiencing that. So there's an African proverb that states, it takes a village to raise a child. So in the village where we were at, there were children everywhere. And they were so excited to see us. When we first came in on this red bus, you know, every day we got on the bus, we left the bus, they'd be kind of chasing behind the bus, waving us as we came and waving to us as we left. When we'd be in the house watching movies, they'd be at the windows peering in and looking in on us. So we decided that it would be really nice to have a party for them before we left. We told all the kids, you know, come with your best dancing skills, that we're going to have a contest. And so all the kids came, and we had a live DJ, we had popcorn, and the kids got candy, and they had a dance-off. There was a touching story. As a little girl, she must have been 11 or 12. She said she was 11 or 12. I'm not really too sure about her age, but she had shorter limbs on the left side of her body. And I remember her going up to the dean and asking her if she could take her to St. John's Hospital, which was the local hospital, children's hospital, to fix her. because she didn't have any money to get fixed, and she wanted to be fixed and be normal like the rest of the kids. So that was one of those heart-wrenching stories. Overall, we had a great experience. I think that everyone learned a little bit about themselves, a little bit about the culture, and a little bit about the importance of health education and nursing. I don't think that we'll ever be the same after this experience, whether it be because of the people that we met or the things that we saw, but I don't think that anybody came back the same person after this experience. Because of that, I find it so rewarding, and I hope that we will continue to go back, because I can't express to you the amount of lives I think we touched and the amount of people who were really benefited from our services. It's a great feeling to know that many of those people left and said, wow, those nurses from Charles Drew helped us, or they were really nice to us, or they treated us very well. I would like for us to be able to continue to foster some of the relationships that we met and that we established. And they're so inviting and welcoming to having us come back again.